I know from the Honourable Minister the number of confirmed deaths due to JE in the past 2 years.
Honourable Speaker, sir, district-wise number of JE death cases. April to December 23, nil. JE death cases April to December 24, 15. JE death cases April to December 25, 3.
Mr. Speaker, sir, we can see from the reply of the Honourable Minister that the cases has been increasing every year, and the death is also quite a number. So therefore, sir, may I know from the Honourable Minister whether the government is planning to have a vaccination drive for senior citizens and encourage young adults to get themselves vaccinated, because I can see from the Honourable Minister's reply in point B that vaccination with the routine immunization program is being done. So for the senior citizens and for the young adults, whether the government is planning to have a vaccination drive.
Honourable Speaker, sir, this vaccine, sir, was introduced as the Universal Immunization Program by Government of India in 2015. Status of coverage of immunization. In Eastern West Khasi Hills, it's at 79%. East Garo Hills, it's at 80%. East Jaintia Hills, it's at 98%. East Khasi Hills, it's at 71%. North Garo Hills, it's at 84%. Ribhoi, it's at 82%. South Garo Hills, it's at 92%. Southwest Garo Hills, it's at 93%. Southwest Khasi Hills, it's at 74%. West Garo Hills, it's at 95%. West Jaintia Hills, it's at 90%. West Khasi Hills, it's at 77%. This is inclusive of the first dose as well as the second dose of the vaccine. If you notice, though I have just read it aloud, the percentages where incidences of JE is higher, there has been an extensive, widespread awareness. Hence, you see that percentages of coverage of vaccination is much higher as compared to areas where incidence is nil or not a threat.
Mr. Speaker, sir, actually, I wanted to know from the Honourable Minister vaccination drive for senior citizens, and young adults.
Sir, the actual JE vaccine is part of the Universal Immunization Program for 9 to 11 months and 16 to 23 months. Now, when we look at the age groups of JE occurrence, we do notice that the largest number is for infants. And because this program was only introduced in 2015, wherever there is high prevalence of mosquito, we recommend for universal coverage.
Actually, what I intended to say is, yes, laboratory is one aspect, then training of the medical officers who are responsible for the initial diagnosis to pick up the symptoms of the disease. So I think that is very important, because the diagnosis of Japanese encephalitis itself is a very complex process. It mimics like many other simple fever, flu like that. So by the time it is diagnosed, if you are late, then the morbidity rate is very high. So are we doing anything to sensitize the medical officers in charge across the hospitals to pick up the cases early so that early diagnosis can be made and preventive as well as curative decisions can be taken early so as to prevent the morbidity.
So preventive or prevention is key, as correctly indicated by Honorable Member. And yes, we are now already working hard. I said intersectoral meetings. What is the cause? What are the symptoms? And yes, it is true that training is vital at this point of time. I want to assure the Honorable Member that there is intensive training going on wherever incidence of JE is high. So there is also the other component which needs to be attended to. Activities such as awareness creation, provision of nets, provision of the fogging that is required wherever, especially in the summertime when there is clogging of water, all of that is being done. We are trying our best, don't want to take too much time to highlight some of the technical terminologies, but yes, we are on the job.
Last question, sir. As we could see the data provided during 2023 and 24, the overall diagnosed cases were 89, and 24 and 25 it is 147. So you could see it has almost doubled, despite the statement that has been laid down that various programs, various initiatives, preventive measures have been taken. So where do we attribute the cause of these, high incidences, almost doubling, whether it is a failure of the programs or initiatives we are taking, or whether the programs that we are taking that is not at the optimal level, and what corrective measures can be done so that the number of cases can be reduced?
Honorable Speaker, sir, when you read data, it indicates a few important references. The very fact that today coverage of surveillance is extensive, testing has been increased. So therefore we see that this testing is probably the reason why these numbers are now appearing, and we are now able to attend to this big threat in not just the state of Meghalaya, but several states across India, sir. And hence I want to assure the member, numbers are being indicated because tests are being carried out. Availability of tests, availability of these sentinel centers, availability of the manpower, availability of everything has given us a clear picture and given us a task which needs to be attended to. So we are focused, and yes, we are attending.
Sir, may I know from the Honourable Minister, when I look at the numbers given in this reply sheet, the concentration, it seems, and the prevalence is high in areas on the Khasi Jaintia region, and we could see that there are hardly cases in the Garo Hills region. So, may I know what is the reason?
Honourable Speaker, sir, numbers indicated are not biased as per communities. We have no intention to say that one area is more infected and the other area is not infected. The Department of Health is combating this disease. No matter where the occurrence is, whether it's in X place or in Y place, we are attending to it. The causes of this disease are also related to farming, related to other practices, and hence I feel that we look at a disease and we ensure that wherever there are these common practices, lifestyles, proximity of animal housing, proximity of, the monsoon season, the increase in temperature, so many factors are there. Let me assure the honourable member, it is not true. Everybody is vulnerable. But if you look at another indicator which I had said, vaccination coverage. Look at vaccination coverage. East Garo Hills, 80%. North Garo Hills, 84%. South Garo Hills, 92%. Southwest Garo Hills, 93%. West Garo Hills, 95%. Look at the coverages in other areas. East Khasi Hills, 71%. You see, Ribhoi, 82%. Vaccination is key to the preventive nature of JE. If you vaccine and you take the vaccination, you protect yourself. We are working hard to break down all the difficult notions that people have, citizens have at large about vaccination. We urge all members of this House to encourage citizens to come forward and take vaccinations for protection.
Sir, it is exactly that what I want to hear from the Minister. Because if I'm made to believe that this disease, the prevalence of this disease in these other districts is not there as shown in this reply, so I want to know. So I would like to thank the Minister for giving a clarification that it seems that in Khasi Jaintia Hills region, the vaccination needs to be improved, needs to be pushed so that the people, the percentage of vaccination will increase. With the increase of the vaccination, I hope that the numbers will be reduced from the numbers that we see today. So am I made to believe, Madam, that whether this disease is not there in West Garo Hills, East Garo Hills, South Garo Hills, as shown in this sheet, in this answer?
You may address the chair, please.
Okay.
Numbers are as indicated in this tablet here, sir, in this table here, sorry, sir. And if the numbers say it is nil, then it has to be nil. But we said, henceforth, we're going to cover the surveillance maximum so that we can ensure. And if there's a number which says nil, that's a good sign for healthcare in the government, in the state of Meghalaya, sir. So, yes, I pray that it will continue to be nil. And I pray that we will be able to continue to address these issues as they come.
Mr. Edlebert, please.
So, after all, we know the fact that health is wealth. So, another virus, our state are facing, fighting one virus after virus. So, in the course of her reply, during the duration of her reply, we heard about, she mentioned about surveillance. So may I know from Honorable Minister, is there any surveillance system in place to monitor and respond to future outbreak of GE?
Honorable Speaker, sir, all of the replies that I have given are indicative of a reply to the question put up by the Honorable Member. We are working hard to ensure that GE does not become another deadly virus.